Hi friends, welcome back. We had a long gap since we had last week. We had a wonderful PG course. I hope many of them were present. If not, please attend next time. It was very wonderful. More than 150 students had come. It was very amazing. More than 20 case discussions were there. So without much delay, we'll start.
Yes, sir.
Okay, fine. Fine. So today's class, okay, we'll continuing with our concept learning series about the orthoplasty. We have completed the hip, we are in the knee. We have completed enough basic concepts about the knee anatomy. Now we are moving on to the deformity. Last class, it was a real life class on varus knee. Today we'll be talking about the bony pathoanatomy of a valgus knee. How valgus knee is different from a varus knee. So before moving on to this is my most important slide. Whenever you are doing a TKR, this slide, it has to come to your mind as soon as you see any knee or you are planned for any TKR. Okay, this is one of the most important thing. So let us start revising a little bit before moving on to understanding what the things are. So we have something called as vertical axis, we have anatomical axis, and we have mechanical axis. Okay, remember these three axes are very important because based on these axes all our orthoplasty is dependent on. Okay, especially the knee one. What are the things we should know? One is the vertical axis, then we have something called as mechanical axis, then we have anatomical axis. Okay, the anatomical axis forms 9 degrees 9 degrees valgus to the vertical axis, whereas mechanical axis forms about 3 degrees. Okay, this is very important. You have to remember this point, and the joint is about 3-degree varus. Okay, this is one way of drawing the alignment or drawing the axis around the. There is other way which many deformity corrections people, the um, whom do you call, the deformity guys, which they do, they take this angles, that is LDFA and MPTA. Okay, what is LDFA? It is lateral distal femur angle, right? Okay, and what is MPTA? It is medial proximal tibial angle. In LDFA, you sometimes you see there is MLDFA and there is ALDFA. Don't get confused. M is with respect to the mechanical axis, whereas A is with respect to anatomical axis. The normal with respect to orthoplasty, I'll be speaking with MDFA with respect to orthoplasty. Okay, what is MDFA? Mechanical. That is about 88 degrees, and proximal tibial metatarsal proximal tibial angle is about, medial proximal tibial angle is about 87 degrees. That means what? The joint is not straight, it is 3 degrees varus. And how do you have a correlation with this, with the existing axis, what we discussed about mechanical vertical axis? We have seen this vertical axis and the mechanical axis, there is a 3 degrees, right? 3-degree varus. This 3-degree varus is the one which gives 3 degrees varus to your knee joint. The joint, this is called a joint orientation angle. The joint orientation angle is 3 degrees. That is because our mechanical axis is 3 degrees to the vertical axis. Okay, with this background, any doubts in this? Still you guys feel any doubt in this, you please ask me. This is very important concept. Okay, for both understanding varus knees, valgus knees, whatever the knees you get, this is very important. Okay, so we'll move on to, with this background, we know that the joint is 3 degrees varus. With this, last time we discussed, that was a real life class about how to decide where the deformity is, especially in varus knees. Okay, whether to know whether it is in the femur side or whether it is to know in the tibial side or whether it is in the joint. Okay, with this diagram, we have decided which deformities are said to be extra-articular, which deformities are said to be intra-articular. any deformity or any apex of the deformity or the cora of the deformity lying about 3 centimeter above the joint, that is above the epicondyle, we call it extra-articular in femur. And anything which is more than 7 centimeter below the tibial tuberosity, we call it extra-articular in case of tibia. Because up to 7 centimeter, we have something attached called the most important structure, that is MCL. Below this, the deformities are considered as extra-articular. With this, we can decide whether we need to correct intra-articular correction. I mean, we need to give intra-articular correction or extra-articular correction. Rough, roughly, they are speaking, any deformity which is more than 20 degree has to be corrected extra-articularly. But remember, this is also a concept. Okay, this is also a concept. With this deformity, that's what, as we discussed, attachment of MCL superiorly and inferiorly, anything which is more above is extra-articular, below this juncture is extra-articular. Anything which is there, it is intra-articular. Does this apply to the valgus knee? The question comes, does it applies to the valgus knees? Okay, valgus knees, the things are different. The valgus knees, the things are different. The most important structure of knee, if you ask me, are three things. One is your MCL, next is your LCL, then ACL. PCL also has role, but if you given me an option, I consider these things are very important. Among these two, among MCL and LCL, the lateral collateral ligaments and the medial collateral ligament, MCL is a part of intra-articular joint, whereas LCL is extra-articular. You can see the MCL is nicely coming from the medial epicondyle, going, attaching, embracing the meniscus and going down all the way here. Whereas your LCL is coming from the lateral epicondyle, not attaching onto the femur, but it is attaching to the head of the fibula. So the concept of being intra-articular and extra-articular deformity for the varus knees is different from what the valgus knees is. Okay. With this one hint, let us start analyzing what are the different things are there in a valgus knee. We all know that the valgus knee is different. So can you list out the things which you think there are different in comparing to varus knees versus valgus knees? Can you please list out? If anyone wants to speak, you can have the mic rights. If you want to text, the chat is open for you. Please go ahead. List out few things which you feel the things in varus are different from the valgus knees. Come on, guys. It's very simple question. Who wants to speak? Yes, doctors. Yeah, please go ahead.
Sir, ligamentous laxity. In a virus,
Okay.
in a virus.
Go ahead. Ligament laxity. Go ahead. Yeah. Then in varus knee, what happens?
Sir, in a
Yes.
virus, there is a sir LCL laxity and contracted MCL.
LCL is lax.
And
Okay. And L is tight. Okay. I agree. Then.
Sir, then
Good.
when in a valgus knee, mechanical axis should be passes from the lateral to the knee.
Okay. Mechanical axis is different. Lateral to the knee and medial to the knee. Okay. Then. Okay. Fine. Good. You have pointed out a very important things. So I just want to bring into a notice. Just we'll come back to our a basic understanding of a stable joint. Okay, how does a joint gets its stability? We all learned in first year there are two things which we call as stabilizers of the joint. One is static, one is dynamic, right? Agree? One, there is a static stabilizer and there is a dynamic stabilizer. In dynamic stabilizers, we have muscles. Okay. We in static stabilizers, what are the static stabilizers? One is capsule, the other thing is bone. Any other point in static stabilizer? Is there any static stabilizers for a joint apart from your capsule and bone?
So ligaments.
Yes, Dr. Sanjay. It is ligament. So, if a ligament is said to be a static, does it changes its length during flexion, extension, or any movement of the joint? No, right? Since it's a
No,
static, unlike a muscle, it doesn't change its length. Okay. The concept of stretched out MCL or LCL is a question. It's a questionable. The ligament cannot stretch it out, right? If you think that the ligament can stretch out, then your ACL, when you always you flex and extend the over a period of time, the ACL has to stretch it out. Does our ACL stretch out?
Yeah. No. No, sir.
Then why do you apply for the things which are on the median? Why do you apply for collateral ligaments? Okay, this is questionable. Tight and lax are a very what do you call, different terms. How do we take it? It's different. Okay, so yes, good, the ligament laxity is there, but you should also think, since a ligament is a static structure, does the ligament becomes loose or stretched out is a questioning thing. Yes, the second point, mechanical and mechanical axis passage, is it on the lateral side or the medial side? Depending upon that, we do call it a varus and valgus knee. So what is the most important thing which we left in understanding the difference between varus knee and a valgus knee? The most important thing is the bony anatomy. What has happened to the bone? Okay, what has happened to the bone, which is leading all to these three things? So before understanding, going on to the bone